So this is going to be our first lab covering a lot of the skeletal system. What we want to do today, first off, is to talk about some of the general features of your bones, talk about the different categories, and then some of the specific features you're going to see that are common, like for example, what does a fossa mean? What does a canal mean? So that when you're actually naming these things over the next couple of weeks, they'll make more sense to you. If you understand the shape, you can narrow down and say what it's going to be called. And then from there, you can kind of ballpark what you need to know. All right. So to first off, when you're talking about bones, you can divide them up in basically 4 different types of categories: long, short, irregular, and flat. So let's give you a few examples of them. Some of the bones you may be most commonly familiar with are going to be the long bones. So just like the name suggests, they're going to be narrow and of a length. For example, this is your femur, and it's going to be around those 18 inches or around the 12 inches, depending on how high the individual is. You're going to have the diaphysis, or the shaft, followed by 2 epiphyses at the ends. But it's going to be long and narrow. So for example, this is your femur. This is your humerus, or in your arm. You can have long bones like in your antebrachial area, your ulna, radius, and even when you get to the hand, the actual phalanges, or the digits of the hand, are also thin and long, so long bones. The other category we want to talk about is going to be short bones. Since we're in the hand, we'll go ahead and talk about that one. So your wrist itself, that allows it to bend back and forth, is actually this area. These are your carpal bones. So if you're looking at them, they're going to be blocky. They're going to look basically square. They're going to be the same size across it. And that's kind of a generic shape to it. You can kind of see they're not just straight up blocks, but they are going to have that specific square or blocky quality to them. One thing you can also see is your kneecap, your sesamoid bone of your patella. That's also going to be a short bone. Other bones are going to be your flat bone, like for example your ribs. It's going to be very narrow. It's going to be flat. And this is when you're adults, most of your marrow is coming from flat bones. Like for example, this is your rib, and then also in your scapula, in the shoulder blade. You see how those are flat on either side. Other parts that are flat bones in your skull are going to be your calvaria, or the skull cap. You can see here that your frontal bone, parietal bones are all going to be narrow and have that flat quality to them. So those are the basic characteristics of the 3. The last category is going to be irregular. Now it's just kind of a grab bag term, but it's anything that doesn't follow into those generic shapes. So like your vertebra, for example, have a not a real random pattern to it, but does have a shape that is not long, square, or flat, so it's going to be irregular. Same thing with your vertebra, same thing with your sacrum, the lower part of the vertebra, and that's going to be the 4 shapes. So long, short, flat, and then your irregular. Okay. Now on your chart, what's going to be in the PowerPoint I'm going to give you is going to be a list of features. So when you're talking about your bones, the way I'm going to run the lecture is that if I want to quiz you on something, it will be either say, okay, name the bone, like this would be an easy one, so this you just say the femur, or talk about a specific part on the bone. I'm going to call that name the feature. So when we're talking about those features, the specific parts on the bone, understanding the general terms will help you narrow down the choices as you're trying to identify the part. So for example, a head of a bone is going to be a rounded area where there's going to be a socket. Like for example, the head of the femur is going to be a rounded epiphysis, or the rounded end of the long bone. Same thing with the head of the humerus. This is going to be the head. Other parts of the long bone, when you're talking about connection points, you're going to have the condyles. Condyles are oval, rounded edges where there's going to be an articulation. Like for example, this is the end of your femur, and this is going to articulate with your tibia. Same thing happens with your skull. You have a rounded oval protrusion where the foramen magnum is, and that's going to articulate with your first vertebra, or the atlas. Okay. If there's going to be a rounded edge, there's also going to be a fossa. Like, for example, these are your articulate fossa that's going to connect with the condyles. So fossa is going to be a shallow depression, and you can see that on the vertebra, and all of your vertebrae have some sort of articulate fossa there. Other fossa can be, like, for example, in your scapula, there's going to be a flat fossa here, a shallow depression here, and a shallow depression here. All these have specific names. So, for example, this is going to be your supraspinous fossa, infraspinous fossa, subscapular fossa. You also have fossa in your hips, like this is your iliac fossa. So shallow depression. Other places can be like spine. A spine is going to be a pointed edge. So for example, this is your spinous process of your vertebra. There's different process spinous here. You have the spine of the scapula here, a raised edge. So that's going to be a specific sharp edge to it. Another thing you're going to hear is going to be process. A process is a general term. It just means an outpocketing or an extension coming out of a bone. It's a grab bag kind of term, but sometimes they're specific. Like, for example, this right here is going to be your mastoid process. The sharp edge here is your styloid process. And these are going to be kind of some basic terms for it. Other things are going to be where things pass through. Like, for example, you have a short hole called a foramen. So, for example, this short hole here is one foramen, and you see it's going out from the skull into the lower part where the jaw is. This has a specific name. This is your foramen ovale. The largest foramen in the body is going to be where the spinal cord enters the skull, and that's going to be your foramen magnum. Other types of things are going to be long passageways. So like a canal, like think of the canals of Venice, long passageways. So for example, this canal is your optic canal. You see it's going from the inside of the skull and going out through the eye socket. So that's going to be your optic canal, where the optic nerve that allows you to see is going to pass through. So it's a longer area. So foramen is a short passageway, canal, long passageway. Other things can be a fissure. A fissure is a long, jagged edge. Like if the earth were to cut open in an earthquake, you'd be a long fissure. So this is going to be a jagged line in the area. So this is going to be a superior orbital fissure and an inferior orbital fissure. Superior orbital fissure, inferior orbital fissure. Other common features can be where bones are going to be next to each other. Just like there's going to be sutures, so just like if you're in the OR and they try to do a cut, they're going to suture that cut together. These sutures are going to be where bones fuse together. And like, for example, this is the coronal suture, sagittal suture, lambdoid suture. So these will have specific parts. And when we get to the skull and talk about the specific parts, this is going to come back. But this is going to be sutures. The way you kind of describe the skeleton in a couple different ways is going to be the differences between something called the axial skeleton and the appendicular skeleton. So axial skeleton means a lot of the trunk, skull, vertebra, ribs, sternum, vertebra down here. Appendicular skeleton is going to be like the appendages or the limbs. So your appendicular skeleton is going to be your scapula, upper limb, all the way from the humerus down to the digits, hips, and then the lower limbs, your femur all the way down to your toes. So that's going to be the appendicular section. So what we want to do, at least for this section, is talk about the axial skeleton. So we're first going to talk about some of the basic bones of the skull, and then the vertebra, and then we're going to, in the next lectures, talk about the appendicular as we start talking about the upper limb and the lower limb. So when we're talking about the axial skeleton, the first thing we're going to see is going to be the bones that are going to be covering the brain. There are 8 bones, in which case cover the brain, in which case the brain sit on. Those are the cranial bones. So the first one you're going to see is the frontal bone, so your forehead, and it extends its way down and makes up the superior part of the orbit, makes up your forehead, and all the way to about the anterior third of the skull. So that's frontal. The lateral sides are going to be your parietal. And you see they're going to be separated by a sagittal suture. So the right parietal, left parietal. The occipital is going to be down here. And you see it's going to include much of the bottom part of the skull. The foramen magnum, where the vertebra is going to pass through, includes where the connection point between the skull and the vertebra are here. So all that's going to be occipital. Most of it you see is going to be underneath and on the inside. On the lateral sides, you're going to see where your temples are. Just like you have a headache on your temple, this is going to be your temporal bone. This is where your ears are going to lie, and this is where part of your bridge is going to be, which is going to be part of the lateral side of your brain. Okay, so that's going to be frontal, parietal, occipital, and temporal. Let's look at those same bones from the inside of the skull. So right here, this was where the orbits were. So this was the superior part of the orbit. This is the frontal bone from the inside. This was the temporal bone from the inside. You see that's making up both the inside, so it makes up part of this ridge. An occipital bone, that's where you see these fossa right here. These are going to be where your cerebellum is going to sit on. We'll talk about the cerebellum in the nervous section. So frontal, temporal, occipital. Temporal, this is still temporal, occipital. There are other bones that are a little harder to see and that require a little of an imagination, and that's why I'm using this skull to kind of show the borders. The first one you're going to see here is going to be this butterfly shape. You see the suture right here. Here's going to be one wing of the butterfly. Here's the other wing of the butterfly. And so that's going to be there. This is called the sphenoid bone. It has some important features, like, for example, where your pituitary gland sits is going to be right here in the saddle. Where your optic nerve is going to pass through from this canal, it's going to be coming from the optic canal. There's going to be important nerves that pass through that's going to control your face, and your jaw muscles pass through these foramen here. So the sphenoid bone has a lot of important features. You can see it also here. Your sphenoid bone is making up this part of the orbit. And you can kind of see part of the sphenoid bone making up this section right here. So refer to the PowerPoint I posted to kind of look at the sphenoid from many angles, and then you're seeing these sutures on where they're going to be. The other bone that's going to be kind of taking imagination to see is going to be the ethmoid. The real place you can see the ethmoid, because it's buried in most of the skull, is going to be this portion. This is called the ethmoid bone. It has some ridges. Part of your nasal, with your olfactory, with your smelling nerve, is going to be coming up through these little small holes right through here. It's a cribriform plate. Part of the covering, or the meninges, like think of meningitis. These are going to be the parts of the brain covering the brain. That's going to be attached there. And then the other part you're seeing here, this nasal portion here, is going to be the bottom part of the ethmoid. So that's going to come down here. So part of what makes up your septum, the superior portion coming down here, is your perpendicular plate of your ethmoid bone. And it's going to merge with this lower bone. Okay. So ethmoid, ethmoid, and that's that. The next one we want to talk about is going to be the bones of the face. Now, they're not going to be directly connected to the brain, unlike your frontal, sphenoid, occipital. These are going to be what's making up the structures of the facial expression, allow your teeth to be in place, allow your nose to function. So they're going to be parts of the face. This is what gets injured if you get like a baseball bat to the face or get in a ski accident. I'll tell you some stories as we do some lectures like that. But the first one we're going to see is going to be the bridge of your nose. These are your nasal bones. So you see this one right here, and there's two of them on either side. These are the most commonly broken bone of the face. Can you see if you get punched in the face, or if you get in some sort of ski accident or hit a branch or something, that's going to be where you have that breaking of the nasal bridge. So that's nasal bone. Also in the orbit, you're seeing the small structure here. This is your lacrimal bone. It's going to be where your tear duct going to sit. So your tears, your lacrimal gland, which is producing your tears, starts here, and then it secretes the tears across the eye, and it's drained into this lacrimal bone, and then from there it goes into the nasal cavity. So that's where that lacrimal bone is, and you have one on either side here. The rest of the face here, if you're looking at the nasal, so that was part of the ethmoid that we talked about before. This is the vomer. So the vomer means plowshare. So this is going to be the lower part of the nasal septum. And you can kind of see it coming down over here as well. But that's going to be the vomer. And the vomer and the ethmoid join together to make up this nasal septum. The other part of the teeth, where the teeth are going to lie in the upper teeth, it's going to be the maxilla. So that's going to make up most of this area. So all the sensation of the face and the teeth come from this bone. Most of your palate also is going to be made of the maxilla, the anterior portion of the hard palate. Other part of the palate, looking down, these are going to be your palatine bones. So right here, and here, and then they make up the walls right here. So your palatine bones make up the posterior part of your palate, but the maxilla makes up the anterior palate. So one way to remember is that it's only the maxilla touches the teeth. Only the maxilla touches the teeth. The palate does not touch the teeth, but that's going to be your palatine bone. So if I put a tag anywhere, and if it's going to have anywhere next to the teeth, that's going to be maxilla. It's never going to be the palate. Palatine's going to be here. The rest of your bone, your cheeks, making up this part of your orbit, is going to be making up your zygomatic bone. It's going to be making up the cheek. You have two of those. And they make up the lateral portions of the orbit, and they make up this area. Lastly, you want to see the mandible. Mandible is the largest of the facial bones, and instead of being paired like your zygomatic bone, your palatine, your maxilla had pairs to it, the mandible is just one solid bone, and that's where you're going to have the lower parts of the teeth. You see it has its own innervation, it has its own foramen and canals. That's going to where nerves and blood vessels are going to pass through, as well as specific parts of the jaw. We'll talk about the actual features next time. So let's go through those again. Nasal, maxilla, palate of the maxilla, vomer, lacrimal, zygomatic, palatine, mandible. The next portion of the axial skeleton is going to be the vertebra. There are 33 vertebrae of all different types of structures to them. They all have, but they can be classified into basically 4 basic categories: cervical, thoracic, lumbar, and sacral. So these are kind of going from top to bottom. And so there's going to be specific patterns you're going to see as you go from cervical from the top, thoracic with the chest, lumbar, lower back, and then the tail being the sacrum. With the cervical, there are 7 cervical vertebrae. We're just going to see a few of them. But the common features you're going to see of all vertebrae, it's going to be all vertebrae have the body of the vertebra. All of them have facets that where the bottom one's going to attach to the next one. And they're all going to have a spine. And that's going to be the same whether that be cervical, thoracic, body, processes, spine, lumbar, body, transverse processes, spine. So those are going to be included with all of them. In the middle of them, you're going to see the vertebral canal, the vertebral foramen, and that's going to be where your spinal cord is going to fit through, all the way from where it's going to leave the skull at the first vertebra, all the way until you get down to the part of the sacrum here where the spinal roots are going to leave. So that's your vertebral canal. It extends all the way from the skull, all the way down until you have nerves passing through the sacrum. So let's go talk about some of the specific parts of the vertebra. So there are 7 cervical vertebrae, but 2 of them that are going to be connected to the skull have special names. So they're going to be like based off of some old mythology. Like for example, this first one, you're seeing this is called the atlas. So it's C1, so first cervical vertebra, C1, and then it goes C1, C2, C3, all the way down to C7. So this first one is going to be called the atlas. So just like in Greek mythology, Atlas was the man who held the world on his shoulders. So this is going to be the atlas, which is going to hold, and it's going to be on top of the skull. So the skull is going to rest on this atlas, and it allows you to rotate your head back and forth along the occipital condyles to the facet underneath. So that's where that rocks your head back and forth. It's very wide. It does not have a vertebral body because the next one going down, this is going to be the axis. This is where that body came from. So its vertebral body is actually part of C2. So the way this sits is going to be rotated like this. So your atlas sits on top of the axis. The reason this is called the axis is because it allows it to rotate. So your head rotates around this axis. So this is the dens of the axis, and that's what's going to rotate around that. The other cervical vertebrae are kind of all the same, all the way from C3 down to C7. One thing you're going to notice with all of the cervical vertebrae, to make it easy, the cervical vertebrae have 3 holes. So if you see 3 holes, you know that's a cervical vertebra. These are where blood vessels pass through. Your vertebral arteries pass out from your major blood supply up to the skull. So that's going to be the vertebral arteries. It does not carry nerves. The foramen vertebral canal carries the nerve, the spinal cord. but that's going to be the transverse foramen where the vertebral arteries are going to run to. So all of them have that. Your C1, your atlas, has 3 holes. Axis has 3 holes. And all the way down to C7, those all have 3 holes. Another thing you're going to notice is that they have very small vertebral bodies. They're only going to be very small compared to, for example, this is your lumbar vertebra, and you're seeing just how large that vertebral body is compared to this. Other thing you're going to notice, its spinous process has a fork to it. It looks like a forked tongue. It's called bifid. So you have 2 parts to it. Unlike, for example, your thoracic, which just has 1 curve to it, your lumbar, which just has 1 edge to it, your cervical vertebra have 2. So, atlas, axis with the dens, and then all the way from C3 to C7, you see small vertebral body, bifid spinous process. Okay, that's cervical. Next one we talk about is going to be the 12 thoracic vertebra. So it goes from T1 to T12. What's going to be characteristic of thoracic vertebra, that's where your ribs are going to lie to. So all of your ribs, this is a rib, they're all going to attach themselves like this to make up your thorax. So it has the ribs section here with the head next to the vertebral body, the tubercle of the rib attached to the transverse process, and those bend back and forth. So for thoracic, slightly larger body, transverse process that can have ribs attached to it, and a very sharp, peaked spinous process. There are 12 of those. With the lumbar vertebra, you're no longer having ribs attached to it. It's going to be the most place we're going to have most of the weight of the spinal cord and the body is sitting on those things. So the lumbar vertebra has a very large, big, prominent body, a very short, stubby spinous process, and it's going to be the larger one. Still has a vertebral canal, but ribs do not attach to it. There's only 1 hole. So you know that's going to be lumbar. Big and fat. Okay, so big lumbar, big body, short transverse process, short, stubby spinous process. There are 5 of those. The last thing you're going to see is the sacrum. The sacrum basically is 5 vertebrae kind of fused together. 1, 2, 3, 4, 5. So it's fused together, and there are little passageways for spinal roots to pass through as you have them form the large nerves of the lower limb, like your sciatic nerve and your femoral nerve. Those pass through there, and that's where those nerves are going to pass through. The nerves are going to go down through this part of this vertebral canal and then exit through these foramen, this sacral foramen. There are also the tailbone. There are 3 to 4 tailbone that are fused together. I don't have those for this one, but there's going to be attaching down on the sacrum throughout here. Okay. To sum up, 7 cervical vertebra. C1 is atlas, C2 is axis, then C3, 4, C3 all the way down to C7. There are 12 thoracic vertebra where the ribs attach to. There are 5 lumbar vertebra, big body, short, stubby spinous process, sacrum. Again, 33 vertebra, so C1, 1, 2, 3, 4, 5, 6, 7. Then your thoracic vertebra, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And you see those are where the ribs are going to attach to. And then lumbar, 1, 2, 3, 4, 5. And the sacral. So one thing to remember is going to be breakfast, lunch, and dinner. You eat breakfast at 7 a.m., so 7 cervical vertebra. We eat lunch at 12 vertebra, 12 thoracic vertebra. And you eat dinner at 5, so 1, 2, 3, 4, 5 lumbar vertebra. So you eat 7, 12, and 5. Breakfast, lunch, and dinner. The last portion of the axial skeleton we want to talk about is the thoracic cage. your sternum and your ribs. So this, you want it to have some protection because your heart, lungs, esophagus, and trachea are all going to be involved here. But the basic portion of your body wall is going to be your sternum. The sternum, you can kind of think of it being like an old school Roman sword. You see a hilt, a blade, and a tip. So the hilt next to the top where the clavicles meet is your manubrium. You have the body of the sternum, and then the xiphoid process. Remember that term process just means an extension. So your xiphoid process is the very tip of the sternum. So manubrium, body of the sternum, xiphoid process. Okay, now there are several ribs, and it depends on where they're going to be directly connected to that sternum, or whether they're going to be indirectly connected to that sternum, or whether they're going to be floating. So when you're talking about ribs that are true ribs, they're going to have ones that are directly connected to the sternum. So if you see here, underneath the clavicle, you see 1, 2, 3, 4, 5, 6, 7. All those have direct connections to the sternum. So see 1 through 7. And then 8, 9, and 10, they have indirect connections merging with 7. Those are called the false ribs. And then your floating ribs, you can see here, 11 and 12, those are all going to be coming off here. So those do not have any connection to the sternum. So they do help protect against the kidney, which is going to sit up around here. So once again, cervical 1, you normally cannot feel the first rib because the clavicle covers it, but that's going to be 1, 2, 3, 4, 5, 6, 7, all directly connected. 8, 9, and 10, indirectly connected to the sternum by merging with 7. And then 11 and 12 are the floating ribs, not connected to the sternum at all.